So let's discuss the patient experience. There's the first experience, which is when they come in for a consultation. Then there's the second experience when they actually come in for the procedure. Very rarely do they happen on the same day, although it can happen with people who travel from abroad. So the first visit is the initial consultation, getting to meet the doctor and for the doctor to meet you. And it's at that point that you'll tell the doctor what's bothering you. What is it about your hair loss that's really bothering you? And the doctor will hopefully be able to come up with a plan to fix it. After you've discussed what you want to do and the doctor has given you your options, your surgical options, because remember, you can have a strip procedure, you can have an FUE procedure, or you can have the non-strip harvest, which is between the FUT and the FUE procedures. And all of the pros and minuses hopefully will be discussed between you and your doctor. So let's say that that's done, you're satisfied with the plan, you go home and you should think about it for a while. If you decide that, yeah, this is something I want to go through with, then what you do is you'll call the office and you will say, hi, I met Dr. So-and-so a few weeks ago and I've decided I want to have a hair transplant. At that point, you'll, of course, see if you could find a date that fits the time that you could take off from work. And as far as taking off from work, I usually recommend patients take a week off. Can they take off less? Yes, they can. In fact, I went back to work only 4 days after my own hair transplant surgery. But there are people who want to take a little bit more time, not because they need to, not because they physically can't work, but because they're afraid that other people will notice that they did some sort of vanity procedure and they just may feel self-conscious about it. But once you find your date, you'll usually make a first payment to hold that date. In most hair transplant offices, you'll probably be the only one, maybe one of two procedures they're going to have that day. So you have to secure it with some form of payment. Once that's done and you put on the schedule, you'll be told to avoid things like alcohol, aspirin, vitamins, that sort of thing prior to the procedure. If you're taking medications, continue to take your medications unless you are expressly told by your doctor to temporarily discontinue it. Make sure that you follow up with your doctor specifically about, especially if you're a diabetic, if you take high blood pressure medication, if you're taking, let's say, medications for anxiety, these sorts of things. Always best to double check with the doctor to make sure if you should keep taking them or when you should just sort of put it on hold, and then the doctor will tell you when to take them again. Very rarely do we tell patients to stop any medicine.
And don't be afraid to have your hair transplant doctor speak to your other doctor. I many times I prefer to do it that way. If you see a cardiologist and you have a heart issue and you take medication for that, ask your hair transplant doctor to give them a call. Doctors speak with one another all the time. He can kind of explain your case a little better, and you can come up with a plan with the two of those doctors together as to what to do with some of these medications.
Very good advice. But don't stop any medication on your own just because you believe you should have stopped it before surgery. How many times have I had patients come to me and say they didn't take their blood pressure medication? I said, why? Because I was having a procedure. I said, who told you to stop? I just thought I should stop it.
Yeah, I've had that too.
Another one is eat breakfast before you come. In most medical procedures, you're told not to eat anything. Here, we want you to eat something. Hair transplants are a very, very minor procedure, very minor, very safe. Very rarely will I ask patients not to eat. So you should always eat some kind of breakfast food. Not a big one, not a big bacon and eggs kind of thing, but maybe some cereal, some toast, something fairly light so that it fills up your stomach, but it's not just loaded down with grease, not one of those. You can have a breakfast like that the next morning after the procedure when you can celebrate, hey, I did it and it's done and my hairs are going to come back.
The next time you're going to see the doctor in the office is likely the day of the surgery. The day of the surgery, a couple important things to just kind of keep in mind. Wear some comfortable clothes to the clinic the morning of. It's a long day. I would say our average procedure lasts about 6 hours, or so. You're going to be kind of in like a dental chair, kind of an adjustable chair the whole day. At some points you may be laying almost flat. Other points you may be sitting up. But it's a long day, it's a lot of sitting, so make sure you're comfortable. You also may want to ask the clinic or clarify with the clinic if you should wear what I call a junker t-shirt, a t-shirt that can be cut off at the end of the day, and a button-up shirt can be put on in its place, because there is a lot of saline fluid used during a hair transplant procedure, and oftentimes the shirts get a little wet, and you may want to get rid of it. Something else to consider is, like Dr. Feller was saying before, you should eat a breakfast before. You don't have to eat anything huge, but you want to have something in your stomach. You want to be comfortable. You burn a lot of energy throughout the day, even though you're just sitting there in a chair and it doesn't seem like you're burning energy. Your adrenaline is pumping the entire day. You're nervous, you're excited, and that energy burns energy. It burns calories just like running a marathon would.
Feel free to bring some extra donuts for your doctor,
yeah.
Preferably the chocolate frosted glaze.
The one thing to clarify with chocolate and coffee specifically is caffeine. Part of the numbing medication that we use has a little bit of adrenaline mixed in with it, and it's going to make you feel kind of up. Your blood pressure is going to be up. Your heart's going to be pumping a little bit with that adrenaline. So you don't want to drink a 64-ounce coffee or get that Starbucks espresso before you come in, because it might make you feel a little too excited. So clarify that with the clinic. Something else to consider is bringing in things that can kind of keep you entertained throughout the day. Your cell phone, books, earbuds that you could watch movies or listen to music through.
I think of it as like being on a long airplane ride.
Yeah,
it's really like what it's like. And that doesn't mean you can't get up and go to the bathroom. You can go to the bathroom 20 times if you want. We don't strap you down to the chair. But be prepared to just sit in like a first class lounge.
Yeah, that's a very good analogy.
During your procedure.
So having said all that, that's all kind of the amp up to the procedure itself. Once you get to the clinic in the morning, you're going to probably meet with the receptionist again first. You maybe fill out some paperwork, relax in the waiting room for a few minutes. And then what is likely going to happen is the doctor's going to pull you in to kind of do the preoperative stuff. What that typically involves, or at least what it involves in our office, is a little bit of another consult the morning of. We're going to kind of review goals again, review what the rough plan is for the day. We're going to go over that medical history one last time, double check that you've been continuing medications you're supposed to, that you haven't been taking anything you're not supposed to. And then what we're going to do is outline the plan. We're going to actually take pictures, map everything out, and draw on lines using sterile surgical markers. We're actually going to draw on where your new hairline's going to be, where the grafts are going to be placed, and we're also going to take a peek at the donor in the back and figure out, at least in part, where we're going to be taking the follicles from back here, from the safe donor area, which is on the sides and the back of the scalp. After that's done, you'll probably go over some paperwork, just kind of explaining the procedure again, the consent form, making sure that you're fully informed and you know exactly what's going to happen throughout the day. And then after that, the doctor is going to take you back and get you started. Every clinic does this part a little bit differently. Some clinics may give you some medication when they take you back. Some people will give you an antibiotic even before the procedure starts. Some clinics will see kind of how you're feeling, and if you're a little bit nervous, they may give you an oral medication just to kind of help you zone out, relax a little bit, because it is an exciting part of the day. And then the procedure starts, and we have several other videos that actually detail the steps of surgery. So if you're interested in those, they're hosted in other places on Hair Transplant Web. But that's kind of what your initial visit's going to be like, what that second visit's going to be like the morning of surgery.
Now, the actual surgery is pretty straightforward. What'll happen is you'll be in that Junker t-shirt. All right. Hopefully you'll have had a little bit of breakfast. You'll have brought your doctor a donut, and then you will head into the back room, sit down in that kind of dental chair type chair, and doctor will numb you. It's little pokes in the back of the head. You can listen to music while you're doing that, or you can just chat with us or your doctor's staff. After the pokes are done, it's numb. I mean, it's like hitting wood. You will go, wow, it's amazing.
Yeah, within minutes.
It's the strangest feeling or lack of feeling you've probably ever had since your dentist. After that's done, the strip or the FUEs will be removed, and you'll kind of feel your head being pushed, but you're not going to feel any pain.
Yeah, you know that we're there doing something,
right,
but you're not feeling it. You're aware there's stuff going on, but you're not feeling anything specific.
Right. Yeah, it really is miraculous. Once, then what will happen is once the strip is removed or the follicles are removed via FUE or non-strip method, the skin will be closed, or in the case of an FUE, it'll be left alone. And then those hair roots will be given to technicians who will examine them and refine them. That is, take off all of the excess tissue. And you're really just sitting